Obviously, we've been through a whole pandemic, and there's a sort of a heightened awareness of all things health.
Yeah.
From your perspective, sort of speaking out on behalf of natural medicine, I guess, to the end consumer, how do you view how that is affecting the way in which the average person is thinking about natural health?
Yeah, great question. And I think you're absolutely right. There are some trends that are changing based on the experience we've all had recently in health and healthcare. I think what I'm seeing from my perspective is that people are more interested in their health. They've always been interested, but now there's an increased awareness that you can take steps yourself to become healthy. I think there's a growing concern that our current healthcare system is not delivering the outcomes that we want or expect or need. There's growing distrust in the institutions of public health, I would say, and the guidance we're receiving from public health. Right or wrong, people are just questioning that. And so they're seeking answers elsewhere. And I think that's what's driving this real interest in personalized healthcare and whole person healthcare. And I'm starting to see patients come in younger and younger to see me. They're basically healthy. They're in their 20s and they're interested in what can I do to be healthy? I never saw that decades ago. I've been in practice about 20 years. I never used to see basically healthy people coming in interested in preventive healthcare. So that is a huge change. Very exciting.
I was speaking to a doctor the other day at a conference, and he said for the first time in his whole career, someone came in and said they wanted to improve their resilience. And he was like, hang on a minute.
Yeah, exactly. Good thing you're sitting down. You hear that from the
patient. It's good. Well, look, let's talk a little bit about naturopathic medicine. This is something that I've been very involved with now for almost 20 years and as big a support as I can be. I used to live in Connecticut where I was licensed, then I lived in New York where I wasn't, and now I've been in California. I've seen, progress in licensure. I think just recently Massachusetts, right, had a big win. So tell us a little bit about what is whole person care, why you communicate it like that, how a naturopathic doctor delivers that whole person care, and sort of what access to that care is, how that is changing.
Yeah, for sure. That's a lot. I'm happy to answer that question for you. So naturopathic medicine has been around for over 100 years. Like we are licensed, I think it's 102 years in Washington State where I am located. But it's yet still a small, very small profession. We are licensed in 26 states now, just recently in Wisconsin, most recent state that got licensed. So we're small, but growing, I would say. Kind of the original, in a way, whole person healthcare profession. We were founded actually by integrative MDs who at that time, 100 years ago, were dissatisfied with their own profession and branched off to create naturopathic medicine, which is really interesting. I think the thing that makes this profession different is that we take a therapeutic order approach to seeing patients. So what that means is we look at their whole person, so diet, lifestyle, nutrition, but we start in our interventions from the lowest order, which is the least significant or least impactful intervention. So establishing their foundation for optimal health. That's addressing whatever underlying causes of illness that they may have, starting there when possible. Of course, if somebody comes in an acute state, you're going to deal with that, of course, but then you want to work back down the therapeutic and get to the foundations and make sure that that's solid for them. That's that resilience you were referring to earlier, trying to make people resilient as possible, because we know our health is more than the absence of disease. Our health is really making us vital and able to heal. We know we have this inborn ability to heal naturally. You cut yourself and it heals. You don't have to do anything. So we know that we have that ability. We want to remove the obstacles to our body from doing, getting healthy and being in balance. And then we stimulate the self-healing mechanisms as much as possible. That's sort of that healing power of nature I talked about. And then we can kind of ascend that therapeutic order, focusing on damaged organ systems if there are, addressing structural integrities, maybe bringing in targeted nutritionals or botanicals. And then, of course, if some drugs or new things like that need to be used, then they are. That's part of the whole continuum of care. It's just different when you start at a lower intervention, than starting with perhaps a drug instead. So the thing that makes naturopathic doctors able to do this is we spend a lot of time with our patients. Our first office call for me is like an hour to an hour and a half long. And then return office calls are typically half an hour or so, because you have to have that relationship in order to communicate and motivate the patient to do whatever it is that you think that they need to be doing. We don't do anything. We provide education. The patient does all the work, right? But it takes time to really help them understand what their options are and figure out a way to achieve a path forward to health and healing, or whatever their healthcare goals might be.
Yeah, well, I'm glad you mentioned the therapeutic order, because out of all things naturopathic medicine, that is by far my favorite tool. And it's because, one, as I was trained in health economics, I recognize just from an economic point of view,
Right.
Using the least costly, least invasive interventions first makes a lot of sense from a cost saving point of view. But also I think it makes sense on a human point of view, because ultimately a lot of people are dying from using higher force interventions that are necessary. Some have argued that it's the third highest cause of death in America, iatrogenic disease. And so starting with the lowest level. And if you look at the way that people are thinking now, I mean, that bottom layer of the therapeutic order to me is really the social determinants of health, which are getting a lot of play now, because ultimately people realize that you can't medicate your way out of a stressful housing situation, right? You need to like deal with that as the foundation. And so I think it's an idea whose time has come for sure.
Yeah, I agree with you. When you think about one of the most important predictors on a person's health is their zip code, then you really do understand that the social determinants of health are the biggest thing playing and driving our healthcare economics in this country. And to me, it's just common sense healthcare, honestly. I mean, you deal with those things, and instead of a medication for the rest of your life, if you can cure whatever that issue was and solve it, that's much better. I mean, we have a healthcare system that prioritizes interventions and procedures versus outcome. And I think if we flipped that and we prioritized outcomes for our healthcare system, we'd be in a very different place right now. We have the most expensive healthcare system, but not the best outcomes.
Well, yeah, that's really interesting. And there's a comment that I want to make on that, because there's a graph that I saw recently, which was showcasing the sort of shift from fee for service medicine to value-based healthcare. And, the way that it portrays that is right now we have like the inverted pyramid. And essentially what the inverted pyramid showcases is that primary care in the current system is really only used as a loss leader to generate revenue in the more high revenue parts of the system, like secondary and tertiary care. And so, that inverted pyramid is the system we have today, where essentially all the tertiary care makes the money and the primary care doesn't really make money, but the primary care practices are being bought up in order to feed into the system. And it was really 10 years ago when I worked that out, or listened to doctors telling me that I was like, oh my God, we have a real problem here, because primary care is all messed up. Now, when you see the way that the population health model, it's the pyramid the right way up, and the bottom chunk of it is primary care, then secondary, and then tertiary. And I think that makes sense to almost anyone who's thinking about healthcare. We need to invest in strong primary care. We know that countries that have the best health outcomes invest in strong primary care. But I couldn't help to notice that it looks suspiciously like, the therapeutic order. I mean, ultimately, it seems to be very, very aligned with it.
Yeah, I love that you observed that. And it's so true. We have to rethink what primary care is and take it out of the box of the doctor's office and bring it into the community. Something I know you've advocated for a long time. Let's talk about how we get it into the schools. We get it into group visits. There's a lot of this information that really doesn't need to be a one-on-one doctor to patient information. But if we start to figure out ways and new strategies to do that, then we'll address more people where they need to be addressed earlier on in the process.
Well, yeah, just a final thought to that. And I don't need to take any credit for it, but in the Community Cure, in the last book, what I showcased was that I feel that if group medicine is done correctly, it can actually satisfy the bottom three layers of the therapeutic order. So, one is the social determinants of health on the bottom. And we've seen that when patients work together, they can actually solve each other's problems. The next layer is turning on the healing mechanisms of the body. And you can see that mindfulness-based stress reduction groups, or even, helping everyone get better sleep, or even things like group acupuncture. Some of the modalities that can be used in a group can all turn on the healing potential of the body. And then, addressing the weakened systems, that's obviously nutrition. That's a big part of like the successful group model. And so I kind of made my own version of the therapeutic order that showcased that, okay, if we can do the bottom 3 layers with groups, ultimately it frees up the naturopathic doctor's time and other providers' time to deal with the top 4 layers, which they're sort of uniquely trained to do, right? Which is, how do we determine when should we use surgery? When should we use drugs? When should we use natural therapeutics? And then when should we use things to reorganize or to help with misalignment in structure? And so that just makes a lot of sense to me, again, as an economist, because, the naturopathic doctor's time is very valuable too. And so I've just seen that groups can be valuable. And I'm excited to just keep talking about this. And I've actually got some podcasts coming up in the value-based care space that I want to talk about the therapeutic order, because I feel like more than anything, it's a sort of way that I see that we can signal to the rest of healthcare that like we've already been ahead of this conversation.
Yeah. I think I agree. This is like you said, a message whose time has come, for sure. And there's 2 things, like when we talk about group visits, I was thinking about this. We see that there's something like 20% increase in learning when it's in a group setting. There's something about that kind of group effect that happens, which is awesome. And then there's a research program that we're just kicking off right now in rural North Carolina, and it's about group visits. And it's really, it's with folks who already have chronic disease in a very underserved community, rural North Carolina. And we're taking the folks that actually already have the disease. And the tagline of this group visit program is 12 weeks, is become your own health CEO. And the reason for that is if you understand more about your body and your physiology, then you're just a leg up on making different choices, right? And it's not, I think that sometimes we think patients aren't curious about that, but they actually are. They're really quite curious about, what is diabetes? How does it work? Why do I care? Like, is it affecting my system? What is the blood system? What is blood sugar? And this is so many questions that you can answer in a group setting and give that education. And then the participants, like you've mentioned, will work with each other to solve their own problems in that local community, because they're all of the same community. So we're doing a documentary alongside that, should be coming out later this year. So I'll be interested to share that with you when we're done.